Hello, ladies and gentlemen. I'm Dr. Ken Berry. I have with me this afternoon, the distinct honor of having as a guest Dr. James Dinicolantonio, author of The Salt Fix and numerous other important works of nonfiction. And I'm going to let him tell you about himself, and then we're going to jump into what I consider one of the very most important topics every day of your life. But here lately, this is going to be a much more important topic. We're live on Facebook, YouTube, and Instagram. So if you see us looking around, that's why we're doing that. We're trying to help as many people as we can all at one time. And so I'm going to be looking for your comments on Facebook and on YouTube and on Instagram. If you have a question, type it in the comments. We're going to get a ton of questions and comments. So if we don't get to yours in 3 or 4 minutes, type it again. And that way it keeps scrolling by. Thank you in advance for the Facebook stars, and thanks a ton for the YouTube super chats and super stickers. Appreciate that very much. That helps us have time and resources to do this. Dr. Dinicolantonio, for those 1 or 2 people in the world who don't know who you are, please tell us who you are, what you do, and why we should care about what you think.
So, the reason why you and I wanted to get together is because I recently published an academic paper on potential nutraceutical strategies that may help boost immunity against RNA viruses. So we published that paper a couple of weeks ago, and I've been publishing in the academic literature for about a decade now with over 250 academic publications. And so with everything that's going around globally, I think, both you and I really thought it was important to really address the public as soon as we could.
Go ahead.
Okay. So yeah, I have a Doctor of Pharmacy degree. I'm the associate editor of the largest open access cardiology journal in the UK. It's called BMJ Open Heart. My website is Dr. James DiNic. So Dr. James DiNic, DINIC.com. And I'm on Instagram at Dr. James DiNic. And so I've been posting a lot on this virus that's affecting the globe right now. And hopefully we can talk about and answer a lot of people's questions.
Yeah, absolutely. And I think Dr. D and I both are 100% committed to the concept of first the 80-20 principle. We're going to talk about the things that you can do with the least effort that are going to give you the most benefits. And by far, without doubt, nutrition is number one when it comes to boosting your immune response, strengthening your immune system, and also helping your immune system be intelligent and wise and not be inflamed and overworked and confused. And so diet far and away is the number one thing I think we should talk about, followed up closely by, so we talk about eating first, then we're going to talk about probably not eating at some point, because fasting, there's reams of research data that shows that the immune system is both strengthened and the response time is shortened by fasting. There's a cadre of minerals that absolutely are vital to proper immune system function. This is unequivocal. Nobody disagrees with this. And so right at the onset, let me say, I'm a medical doctor. I've been practicing medicine for 20 years in the clinic, in the ER, and in labor and delivery, in the ICU. This is not medical advice. This is an MD and a PhD talking to you about what we've spent our lifetime, our career doing for a living, and what we've learned along the way. And very often people think they need expensive medications or expensive supplements, and that's quite often not the case. So no medical advice here, just 2 doctorate level professionals talking. I've put links down below in the show notes on Facebook and YouTube for all of Dr. Dinicolantonio's, his book, his papers, his website, and then some of the things I think we're going to be talking about during this live. So where do you want to start, Doc? Let's start at the base of the pyramid, the absolute most important thing, and then let's work our way up.
Okay, perfect. Yeah, let's go sort of 30,000 feet high level, and then we'll kind of get into the weeds.
Yes, perfect. Because that's what most people want to know is, what are the 3 things I need to do right now? What can I do today or tomorrow to improve my immune system response and the strength of it without at the same time confusing it or making it irrational? And I think that's a very valid question. And so let's start with the absolute bedrock of not only immune health, but all health, which is nutrition.
Yep, absolutely. And even above nutrition, let's even go, let's say even more at the base, social isolation, right?
Right. Oh yeah, definitely.
You know, everyone, there's a lot of good data that basically social isolation, isolating yourself is the most important thing we can do right now. We need to basically band together as a community and only go outside of the house for essentials.
Right.
There is dramatic data that is going to absolutely help reduce the spread of this virus.
Absolutely. And this is something that we've known for hundreds of years, but people forget this. And so there's several key facts about viruses, and we're not going to be naming any viruses by name today, because what we're talking about applies to every single virus that I can think of without exception, right? And so if you are not exposed, either directly or indirectly, to an infected human or animal, then you cannot possibly catch the virus. That's one of the postulates from the very beginning of time in infectious disease, is you have to be exposed to the virus to catch the virus. And that's why right off the bat, we're going to tell everybody who's 60 years and older, or if you have multiple medical conditions, you have to take injections or pills on a daily basis for your health, you need to go home and stay home. And you don't need to let anybody in unless it's mandatory that they be in your home. And I know this sounds a little draconian, and this sounds a little like a Blade Runner movie, but at this point in this situation, absolutely. And so this goes for the flu season too. If you have multiple medical conditions and you're 75 years old, you don't need to be going to concerts during flu season. You don't need to be going to the mall and just touching every rail and every doorknob. That's bad behavior, because anytime you're metabolically ill, you're at risk. You're at increased risk of catching a virus, period. Any virus. It doesn't matter which one you're talking about.
Hey, Ken, they're saying the echo is pretty bad on your end. Should you try the earpods?
No, they're not hooked up to my computer. I've got my volume turned all the way down here.
Let me.
I bet it's just on Instagram that I'm having it. I'm not seeing any comments on Facebook or YouTube about this.
Hey guys, how's the echo now? Is it better?
Maybe that's better now.
He's saying it's coming through your speakers. Hold on. It's better. Someone said it's better now.
Okay, beautiful, beautiful.
Worse on Doctor. Now it's bad. Worse on mine. It's not him. It's you.
Yeah, Amy Sue says she hears no echo at all.
Worse.
Lori B says we're both good, so let's proceed. We are not in professional recording studios, so therefore we're not going to sound like CNN or Fox News. It's just we're going to have a little echo.
Okay.
Yeah. Okay, Doc. So definitely social distancing, social isolation. These things are vital when it comes to this. You've got to stay away from people who are infected. And one of the main dangers about this latest virus that we're all talking about is it looks like it has a latency period of several days. It looks like that someone can have the infection and be shedding the virus for multiple days and have no symptoms whatsoever. And so if you go to the restaurant or the mall or, the big box store, that guy that just walked by you, he looked perfectly fine, had no fever, had no symptoms, but he may very well not only be infected, but be shedding the virus. And if you're 20 years old and preeminently healthy and feel great and have no metabolic disease, you're probably pretty safe. But you got to think about the rest of your family and friends who may not be in such a fortuitous position as you.
Exactly.
Yeah. So definitely all the hand washing is super important. Keeping your hands away from your face, mouth, nose, eyes, ears, and other body orifices is also very important. There are some reports that this latest virus may actually be spreadable by fecal contamination, like hepatitis A. And so, again, hand hygiene is absolutely, it's not optional. That is mandatory if you're going to slash your risk of catching any infection, and definitely this infection.
Yeah, I completely agree. And, hand washing too, at least 20 seconds with soap and water.
Absolutely. Absolutely. So we're taking all our precautions that we can. Hand washing, distancing, staying home as much as possible, staying at least 6 to 8 feet away from each individual human when we do have to be in public. wiping down everything with at least a 60% isopropyl alcohol wipe, or bleach. It also seems to work very well from the research I've read on this kind of virus. Now let's talk about how do we strengthen our body? How do we strengthen our immune system? What do we eat? What do we not eat? What do we add? What do we subtract?
Yeah, so I mean, I guess for chronic maintenance for immunity, vitamins and minerals are extremely important.
Yeah.
Zinc, especially with copper, because zinc can reduce the absorption of copper. Selenium is also very important. There's, glutathione peroxidase, which, depends on selenium as a cofactor. And
Right.
basically glutathione, in order to build that, you need two particular amino acids, cysteine and glycine. And so basically those two are very important. And glutathione is our body's natural endogenous antioxidant. And the reason why that seems to be important in viral infections is because the main cause of death in RNA virus infections is, they're saying they can't hear me. Hold on.
Is that on Instagram? I don't see any negative comments on.
Let me try that.
Yeah. Okay.
The AirPods.
Yeah. That'll probably get you back on Instagram.
Okay. All right. I'm going to try the AirPods. Echo is better with AirPods. Okay.
Yeah. And so I definitely think the supplements, and they don't necessarily have to be supplements. You can get virtually any of these in your diet if you know what to eat. And that, I think both of us would highly advise you to eat the proper food. But as 20 years as a family doctor, working closely with surgeons, I have found, and I've actually put some links down below, the biggest thing that a surgeon will say to you is if you have hyperglycemia or high blood sugar or an elevated A1C, which is evidence of a chronically elevated blood sugar, they're not going to do surgery on you. They're going to say, no, we got to get that down. We'll check it again in a month. And if you're doing better, then we'll do your surgery. The reason is because everyone who is in a high blood sugar state is at increased risk for infection. This is settled. There's no debate about this whatsoever. If you're in a hyperinsulinemic state, that's going to also lead to inflammation, and that's going to lead to a confusion of the immune system. None of these things you want, right? And so for everyone out there who's listening who is a pre-diabetic, type 2 diabetic, or even a type 1 diabetic, or you have at least one of the markers of metabolic syndrome, and I talk about all 5 of those markers on another video on my YouTube channel, you are at increased risk to catch any virus, including the one that the news media won't shut up about currently. So if your blood sugar is running even a little bit high, you are definitely at increased risk of infection from a virus. Literally you can at this point, if you don't want to catch this and spread this to your family, you're really no longer at the luxury of saying, well, I don't like meat, I don't like broccoli, I don't like liver. Yeah, you know what? This kind of episode that's happening in our society right now is basically a wake-up call. Hey, we're all grown-ups here, okay? You may have lived on chicken strips and ketchup for the majority of your life, but this is not the time to complain, because this virus and no other virus cares about you complaining. You have got to start eating the proper human diet spectrum. I don't care if that's an ovo-lacto-pescatarian low-carb diet or if that's just a pure fatty red meat diet with organ meats. You've got to start eating somewhere on there, because those are the diets that are going to lower your blood sugar back to low normal. And those are the diets that are going to lower your insulin level back to normal or even low normal. That's the sweet spot that you absolutely want before you even start thinking about minerals and vitamins and supplements and any of this other stuff. You have got to fix that diet. And I also think, I know so many of you guys have tried to talk to your family about low carb, banting, keto, whatever, and they just won't listen, right? Well, I think maybe the news media has got their attention now. And so this might be your one opportunity that you could share a video on Instagram, YouTube, or Facebook and say, hey, here's this MD and this PhD. They're not even basically saying, they're literally saying that your high blood sugar is increasing your risk of catching this infection. And if you catch it, you're going to give it to me. And so if you love yourself at all, if you love your family at all, It's time to put away the highly processed carbohydrates. It's time to put away the soft drinks and the fruit juices and all the crap that spikes your blood sugar and spikes your insulin, and start eating real, whole, nutrient-dense, human-appropriate foods that are going to lower your glucose, lower your insulin, and also lower your levels of inflammation so that your immune system is 100%, right? It's not crippled because it's having to fight 14 different chronic fires here and there and everywhere. It can focus all its energy on this one thing, which currently looks like the most important thing to be focusing on. What do you think about that, doctor?
Yeah, I mean, I think at the basic level, nutrition is so important. Basically, you know, if you're going to catch the virus, you're going to catch it, right? But if you have optimal nutrition, it can help reduce the replication of the virus. And
it looks like from the research I'm reading, Doc, that, you know, they keep saying, oh, if you're older, you're more at risk. And that's definitely true. But how much of that is because as you get older, you're more insulin resistant, or another way of saying that, you're more hyperinsulinemic, because the actual conditions that they talk about that put you at increased risk, diabetes, high blood pressure, heart disease, right? Kidney disease, all of these things are related to metabolic syndrome. All of these things are related back to your diet. And so if you have any of those conditions, including high blood pressure, chronic kidney disease, if you've had a stroke in the past, you are at super high risk from this or any virus. You got to start taking precautions. And this is something you can literally start to turn around. As soon as this video is over, you can start to improve the strength and health of your immune system.
Yeah, exactly.
So are we still on IG? Can people still? Somebody said IG's messed up, but Facebook is solid. So we're just going to continue on Facebook and YouTube. You guys, if you've already asked a question, type it again in the comments. We're going to try to get to those. Now, Doc, you've actually written a paper, and you cited a few more about things that you can get in your diet or take a supplement that will actually seem to improve the immune response. And some of these are rodent studies, and I think one of them was a human study. Talk to us about what you found.
Yeah, so the most evidence-based supplements when it comes to RNA viruses is elderberry and N-acetylcysteine. Yeah. So we actually have, you know, clinical studies in humans in patients with influenza and common cold, that those two supplements have utility.
Yeah. And we actually have used N-acetylcysteine for years in things like Tylenol overdose, and I think it actually helps thin mucus secretions in the lungs. We've used it for several things over the decades, but so I'm not sure if it is because of the mucus thinning or the mucus lessening attribute of it, or if it had some other mechanism of action. Are you clear about that?
So I don't think anyone's really 100% clear, but you're absolutely right. N-acetylcysteine has good evidence for chronic bronchitis. Yeah. Because it is a mucolytic, right? It helps thin out the mucus.
Right.
The main reason why we seem to think that it helps with RNA viruses is because, again, the primary cause of death is the inflammatory storm in the lungs. Basically, your immune system kills yourself. It overreacts to this virus, damages the alveoli in your lungs. You can no longer oxygenate your body. You die of acute respiratory distress. Yep. So N-acetylcysteine helps boost glutathione, which is an antioxidant, helps basically calm that cytokine storm in the lungs.
Absolutely. Yeah, and I think the research on that is fairly compelling. I don't think there's any doubt about that. What other diet specific foods or specific supplements are you really enamored with the research on?
Elderberry is very interesting. It has a meta-analysis in 4 clinical studies in humans. Most were in influenza A and B, and the other was in the common cold. And it seemed to reduce the duration of symptoms in influenza by 3 to 4 days.
Nice. That's better than Tamiflu.
Yeah, I mean, you typically, your symptoms in influenza is about 7 days.
Absolutely.
So if you can reduce it 3 to 4 days, that's pretty compelling.
Yeah, that's a big deal. And, humans have been using elderberry extract in some form or another, whether it's a syrup or whether it's just the dried berries. We've been using that for hundreds of years. And James, I'm basically a carnivore for the last 14 months, but I absolutely believe that humans have used vegetables, plants for herbs, for medicine, and for seasoning forever. I don't know if there's a time in recorded history when we weren't using plants for those things. And I think that's absolutely an appropriate use for plants as medicine, seasoning, and herbs. And the elderberry falls perfectly within that. So Nisha actually just bought a pound of freeze-dried elderberries, and she's going to make us up some concoction or decoction. I'm not sure what kind of concoction she's going to make us, but she's going to make us something with that. And I think that's probably going to help a little bit. But I don't want anybody to make a mistake of thinking, oh, okay, so I'll buy some elderberry syrup and I'll be okay, and I can keep eating my Special K and skim milk and keep having my whole wheat bread for lunch. No. You got to work on the foundation first and foremost. You got to lower your blood sugar. You got to lower your insulin back to low normal. Then if you want to add the elderberry extract or syrup, you might get an extra 1 or 2% protection from that. From the research, it looks like you definitely do. You're going to have less symptoms with the NAC. You're going to be able to thin the secretions so that you can cough those up easier, so they won't block the alveoli as completely. All of this stuff matters, but do not get lost in these weeds that we're about to talk about and forget that the number one most important thing, the number one cause of post-operative surgical infection is diabetes, is high blood sugar, is insulin. That's it. Nothing else is a bigger deal than that. So you've got to eat a diet that's going to lower your blood sugar and your insulin. And then I'm happy to talk to you about adding these other things. So you've talked about the NAC. We've talked about selenium and zinc, two very, very important elements that act as minerals in the human body. They are essential as far as I can tell. The human body cannot make elements. We do not perform nuclear fusion in our bodies. So they have to be in the food you eat, or you just didn't get any. That's kind of the truth of that matter. And so anything you want to add about zinc and selenium?
Yeah, so zinc in the ARED study, which is a randomized controlled trial in about 5,000 elderly patients, they tested 40 milligrams of zinc with 1 milligram of copper twice a day. Caused a significant 27% reduction in mortality. It was primarily driven due to deaths from respiratory causes. And that's what we're talking about here, right? Dying from a respiratory cause.
Yeah, and Rob says, so elderberries are not an option for type 1 diabetes. Rob, they absolutely could be if you use the dried berry and you don't add any sugar to it. Nobody says that your elderberry syrup has to taste great. We're not talking about the kind of syrup you put on pancakes here. We're talking about a therapeutic use of an ancient elderberry extract. And so, I think it's perfectly fine. You can actually buy elderberry extract in a capsule form, I think. What do you think about that, doctor?
Yeah, I think most of the studies, they've used elderberry extract and used that either extract as like a tablet or a syrup.
Yep, exactly. And so it does not have to be full of sugar. Just because we said the word syrup, don't think pancakes, okay? That's not what we're talking about. This is like a cough syrup. That's the kind of thing we're talking about here. Okay, so we covered that and that and that. What about ferulic acid?
So what's interesting is drinking coffee actually produces ferulic acid in the body. So that chlorogenic acid in our coffee that we drink gets converted to caffeic acid, and then that gets converted to ferulic. And ferulic acid is probably how elderberry possibly works, is anthocyanins, they get converted to ferulic acid in the body. And that helps. That's one of the body's very potent antioxidant. Yeah. And so that can help with that inflammatory cytokine storm that we were talking about.
Absolutely. And so if you're like, ferulic acid, what the hell is that? And where do I get it? It's in coffee. Don't worry about it. Just make your coffee strong. Drink it every day. It's going to have hundreds of other metabolic benefits for you. It may even decrease your risk of dementia. Maybe some of the observational research looks like it shows that. But you're going to be getting ferulic acid, which is going to be strengthening your immune system. Yeah, I love it. What's the next one you want to talk about, Doc?
Vitamin C.
Vitamin C. Okay.
So vitamin C is interesting, right? Because from an evolutionary perspective, we would get it both from animals and plants. And we would hunt animals, and when an animal is stressed and exercises, they will produce 10 times the amount of vitamin C. And so we would actually get a lot of vitamin C through fresh meat, interstitial fluids, blood, all those things, as well as plants, right? And so we used to consume a lot of vitamin C. If you look at animals in the wild, gorillas, they consume 5,000 milligrams. Monkeys consume 700 milligrams that are 1/10 their size. And we no longer produce vitamin C. And so our diet is dismal in vitamin C. And it's super important, not just for reducing the inflammatory storm, because vitamin C can get concentrated in the fluids lining your lungs and can help fight the inflammatory storm. White blood cells will take it up as well to help calm the inflammation in the lungs.
Yeah, and Carmen, we're talking about vitamin C right now. I really feel like there's a spectrum of need for vitamin C in human beings, Doc, and you may totally disagree with that. And just to let you guys know, we're great friends, but we don't agree on every single thing that we talk about. And that's totally fine, because we're all bumbling around in the dark, trying to discover or rediscover the truth. That's what we're doing here. And so I think if you're eating the standard American diet full of processed carbs, yeah, you definitely need 1,000 to 5,000 units of vitamin C a day. 100% agree with that. But as you lower the carbohydrate intake, I myself, I have not been sick a single time in 14 months that I've been, essentially zero carb. I eat organ meat 2 or 3 times a week. And so with that liver, I'm getting a little bit of vitamin C. In fresh meat, I'm getting a little bit of vitamin C, but nowhere near 1,000 milligrams. They're absolutely right about that. But I've become friends with a lot of people in the carnivore community, and they just don't get sick, Doc. They just never get a cold. They never get the flu. They just don't get infections. And so obviously they're getting maybe 100 milligrams of vitamin C a day, maybe. And also when we check our vitamin C levels, they're still within normal limits. And so something's going on there. I heard one person opine that they thought that maybe, because we lack one key enzyme in the vitamin C production pathway, and they opine that if you eat low carb enough, maybe that enzyme kicks up and we can actually make our own. I doubt that, seriously. But I mean, it's a provocative theory. More than likely, though, as you eat fewer carbs and fewer inflammatory foods, you just don't need as much vitamin C to do the job. But if you're eating a crap diet, Pepsi's, Cheetos, cornflakes, yeah, you need to take at least 1,000 of vitamin C every single day.
Yeah, what could be going on there too is humans, they have the ability to recycle oxidized vitamin C through red blood cells. And so if you are at a low inflammatory state, you don't need as much vitamin C. Exactly.
And it also looks like that people on very low carb diets or carnivore diets, their red blood cells actually live longer. And so it would also make sense in that respect as well. So that's excellent. Thank you for that. Do you eat raw liver, Doc?
Not raw liver.
No, I don't either. I cook it for about a minute. I saute it 1 minute on each side, the thinly sliced, with some butter and some garlic, and it's delicious. No, I don't eat raw garlic, but I'm not above it. I would try a spoonful, but I haven't done it yet. What about glucosamine?
Mm-hmm.
What about that?
Basically, our paper had 2 main strategies: how to boost your own immune system, and then how to reduce the inflammatory cytokine storm in the lungs. Okay. And so glucosamine is interesting because it boosts something called the mitochondrial antiviral signaling protein, which helps boost interferon regulatory factor 3. Everything comes down to interferon regulatory factor 3. That is how we produce type 1 interferons, and type 1 interferons produce antiviral antibodies. So anything that stimulates that is very important. Yeah. When it comes to glucosamine, again, it's boosting that mitochondrial antiviral signaling protein, and it helps boost our own type 1 interferons. It seems that you need a fairly high dose, at least 3,000 milligrams. But it's interesting that, even maybe up to 10,000. Again, we can't make recommendations. Right. I'm just, talking about the literature and the dosing of how this would potentially work.
Yeah. And excellent low carb sources of glucosamine include homemade bone broth. You can't always be sure about the stuff you buy at the store, but if you make it yourself, it's going to be full of glucosamine. Gnawing the cartilage off the end of those chicken bones, absolutely. That's going to help. And then eating sardines or anchovies, any kind of small fish that still has the bones and cartilage in it, that's going to be a ton of glucosamine. So 100% agree that that's important. And I would much prefer to get that in my diet than to take a supplement. But if you hate all the things I just mentioned, then you might want to look at a glucosamine supplement. Yeah. What's the next one on your list, Doc?
Beta-glucan.
Beta-glucan. All right.
So this is from mushrooms, brewer's yeast, algae. Basically, they're polysaccharides in the cell wall called beta-glucans, and they are immune stimulating. They activate dendritic cells, and these dendritic cells present antibodies to our lymphocytes. And so the more you're presenting these antibodies, the better you're going to have, protection and fight against these viruses.
Yeah, exactly. And you can get that in a supplement, right?
Mm-hmm.
Yeah, you can get that.
I take it as a capsule.
And what rough milligram strength does it come in?
It normally comes as 250 milligrams. I take 2 of those per day, so 500 milligrams. I do that chronically.
Yeah, you chronically take 500 milligrams a day. Okay, beautiful, beautiful, good information. And then what about spirulina? What about that? Let's talk about that.
I take spirulina every day. One of the primary drivers of inflammation in the immune cells when you're being attacked by these RNA viruses is through NADPH oxidase. That spits out superoxide anions. That reduces nitric oxide as well because it produces hydrogen peroxide, uncouples endothelial nitric oxide synthase. Don't want to get too into the weeds of how this all works, but spirulina can inhibit NADPH oxidase and that inflammatory storm. And if there's clinical studies testing spirulina in HIV patients, randomized control trials showing dramatic reductions in viral load and significant increases in CD4 cell count.
Yes, perfect. I love it. And you can also get that as a supplement, as a capsule.
Yeah, I take that as a supplement. Yeah.
And do you take that as well on a daily basis?
Yes. Yep. I take about like 4 grams per day usually. I mean, I was taking up to 15 to 30 grams, but for maintenance, I think 2 to 4 grams works good for me.
Gotcha. And it's just basically there's the blue-green algae that they harvest, and they can get it from that, and then a couple of other things.
Someone was asking about chlorella, which is a green algae. Spirulina, most people know it as a blue-green algae, but technically it's a cyanobacteria. Chlorella seems to boost natural killer cells. It's a little bit different, and it's very good at binding heavy metals in food. So I also take that every single day.
Perfect. Rain asks, should we fast if we are trying to prevent a virus or if we catch a virus? What do you say about that?
I don't know. I honestly don't know if it will dramatically help or not. I don't think we clinically have the studies to back it up, and I'm always cautious if you don't have the studies to show it. Theoretically, are there mechanisms? Absolutely, because when you're triggering instead of growth, repair when you're in fasting, right? Your body is under attack and it needs to repair the epithelium that's being damaged in the lungs. So if you can boost autophagy and repair mechanisms, theoretically that makes somewhat sense.
Yeah, absolutely. And I tend to agree with that. There's some limited research that might support fasting, but that fasting is something. And so you guys know I'm always talking about basically the 3 prongs of whether you should try something or not. Does it make ancestral sense? Does it make common sense? Is there meaningful research to support it? And so I think everybody's grandmother in the world has talked about, starving a fever. I mean, that's in the vernacular of probably every major language on the planet. There's a reason for that. And there's a reason that so many cultures, when they get sick, they immediately start to fast. There's a reason that basically every mammal that I know of that's ever been studied, if they get sick or injured, they immediately stop eating. And I mean, there's a reason that mammals do that. And I think that behavior is a very protected behavior evolutionarily. You know what I mean by that, Doc? Something that's been going on since before we were Homo sapiens sapien, that goes back into the evolutionary record millions and millions of years. If animals from back then were doing it, that's probably important. We should probably mimic that. So I think fasting is a big part of not only boosting, but strengthening and also calming your immune system, because so many doctors will talk about, oh, your immune system's too strong or it's overreacting. I think that's the wrong way to talk about this. You want a strong immune system, but you don't want to be inappropriately attacking your antigens instead of the foreign antigens that are actually a threat. And so you want a good, strong, robust immune response, but you want it to be appropriate and calculated And your immune system can't really do that if it's inflamed and confused and just running amok because of all the chronic inflammatory fires in your body. So fasting, I think, will be a huge help in both prevention and in treatment. But the control research is not 100% clear on that.
Right.
Yep. What else do we need to know, Doc?
Let's talk about the natural response to these viruses and how our body naturally wants to fight off these viruses.
Absolutely.
First line of defense, fever. Why? Yes. RNA viruses seem to be susceptible to heat, high temperature.
Yeah. And in fact, most viruses and most bacteria, their rate of replication or their rate of growth goes down as your body temperature goes up. And I'm so glad you brought this up. I'm working on a YouTube video about this right now. Mm-hmm. Is there any convincing controlled research that shows that you should take an antipyretic, a fever reducer, if you have a viral infection? And my answer is 100% no. That's not going to help.
With the caveat.
Yeah, with one.
The caveat would be if you hit a certain temperature, 103.5 or higher.
Right. Yeah, and so 104 Fahrenheit or 40 Celsius, you may need to take something because that might be a risk to brain tissue, and that even is not very clearly proven. That's mainly theoretical, but who wants to take a chance with the patient's brain? So at about 104 or 40 Celsius, we'll start to treat a fever, but you're actually you're hamstringing your immune system. If you start taking ibuprofen or acetaminophen as soon as you start to have a low-grade fever, I'm 100% against that, and I think most people who've thought that through would also be against that. So fever, that's that. And so a lot of people think fever's a disease, Doc, but it's not. It's actually the first step in your body's attack on the virus, right?
Correct. So basically there seems to be this killing perfect range in the body, and it's about 101.5 to 103.5. And when you start suppressing fevers, you are obviously not going to be able to fight off RNA viral infections as well. So there's pretty compelling data that people who quickly get fevers to these viruses help reduce the replication of those. People who don't respond with a fever, it ends up replicating much more, getting into the lungs, causing more damage, increasing its virulence.
Yep.
And there's an artificial way to kind of create a fever, and that is basically boosting core body temperature with sauna.
Yeah.
And so I posted a ton of studies on sauna's potential prophylactic, effects on RNA viruses.
Yeah. And we actually see animals mimic this. They'll go out in the midsummer sun and they'll lay in the sun and take a nap. And it's got to be smoking hot, but they don't care. They do that for the hormetic influence on their immune system to boost their immune function. Our dogs will do that in the house. If we have the fireplace on, they'll get right up on the hearth and get as close to as they can get to the fire. And it's burning up in the house, and they're laying right on top of the fire, just close enough they don't get burned. And they'll lay there for 30 minutes. And I think that's their version of a sauna, is doing that. And so definitely getting really cold, getting really hot, but definitely the sauna in this case. If you're feeling like you're coming down with something, or you definitely have an infection, raising your core body temp without going above 104, I think is absolutely going to help your immune system to decrease the viral replication and help your immune system ultimately win the battle.
Yeah, and how this seems to work is through heat shock proteins.
Right.
They prevent in the nucleus basically the export of these nucleoproteins, which is really interesting. So that you literally reduce the replication of the virus if you start activating heat shock proteins. And the way to do that is through, particularly infrared sauna seems to be better than just sort of your convection baking regular saunas, right? Because typical saunas and steam rooms, the outside ambient air is very hot and you're heating up your skin. Infrared, especially a full spectrum infrared sauna, seems to heat the whole body, right? Goes deeper than just the skin, goes 3 to 4 inches deep, heats up the tissues better. You'll probably get a better activation of heat shock proteins with infrared saunas. And so
but if you can't afford that, then a good hot steamy shower is going to be way better than nothing.
So yeah, basically any way you can raise your core body temperature, right? Hot bathtubs is going to potentially have benefit here. So I posted a clinical study in 50 patients where they were basically, half of them were given sauna therapies for months, the other weren't, and it cut the risk of getting common cold by 50%. So this seems to be like a real effect. And in animals, we can sort of clinically prove things because we can use animals, we can infect them, we can kill them, we can do all these interventions. So what clinical studies in animals show is if you give them basically sauna therapy prior to infecting them with influenza, their mortality rate dramatically goes down. Their lung pathology goes down when you infect them with influenza, and their viral replication goes down. So that is pretty compelling.
Absolutely. And tell me, so, and then what about with the cold therapy? It seems to be very, very popular these days. What do you think about that? Is that a thing? Is that something that we should,
For viruses, I think it's a little bit, I mean, cold therapy has other hormetic benefits, don't get me wrong. Right. But again, the body's natural response is not to chill itself, it's to heat itself.
Exactly.
So that's the absolute opposite thing of what you want to do, is to jump into a cold shower when you have an RNA viral infection.
Yeah. And my grandmother, when I was a kid and I had a fever, I would go to bed, you're shivering. And so you're actually wanting more cover when you have a fever. And I used to remember thinking as a kid, what the hell's wrong with my body? Why, if I'm too hot, why am I wanting more covers? And she would literally put 4 blankets on me, and she would call that breaking the fever, right? But basically what she was doing was elevating my body temp up to that sweet spot where my immune system could really just kick ass and get rid of the virus or bacteria that I was suffering from.
That's so interesting. You know how they always say to sweat out a fever? They never understood why, though, and it's heat shock proteins. Now we know.
Yeah. And there's so many things like that are so fascinating. Like just like the fasting thing with animals. When they're sick, they immediately stop eating. And that's even a conserved behaviors in reptiles. They'll stop eating if they're infected with the virus. And so that kind of thing is so fascinating to me. We may not have the biochemical mechanism plotted out yet as to why that works, but it wouldn't be conserved through all of the evolution if it weren't a real thing. And the same goes for sweating out a fever or breaking the fever or, bundling up. That absolutely is putting you in the sweet spot of making enough heat shock proteins to activate all these other mechanisms that just shut down the virus.
And there was an expert that Joe Rogan had on his podcast, and I've had a lot of questions about this because I think he was asked, and I haven't watched the podcast, but what people are saying was he was asked if sauna would help because of the heat, because 133 degrees Fahrenheit will literally kill these viruses. Not completely, but you start to see rapid killing every 15 minutes. And so I think he addressed the fact that you're never going to get your lungs to 133 degrees Fahrenheit, and you're not.
You don't want to. Don't
want to. That's not how sauna therapy works. So I want to address this quote unquote expert that Joe Rogan had on. He's not thinking about how this activates heat shock proteins and prevents, these exporting of viral nucleotides.
Yeah.
So
you don't have to get your lung alveoli to 133 degrees to get the benefit of the sauna, because when you activate the HSP, that's going to circulate through your entire body, including your lungs and alveolar tissue.
Yeah.
Love it. Love it. Okay. Let's see if we've got any good questions. David saw that Rogan episode, man. Rogan, he's just got his finger on the pulse of everything, doesn't he?
Certainly does. You got to love him for it.
Yeah, absolutely. What about immunoglobulin G for immune support?
I haven't done a lot of research on that, so I'll have to pass on that one.
Yeah, me too. I don't know much about that. I thought that might be within your wheelhouse. Yeah, definitely smoking. Jessica Link says smoking and alcohol, 100%. What are these things? They're going to cause irritation, which leads to inflammation. Anytime you've got inflammation, you're going to have to sequester part of your immune response to deal with that inflammation. And so if you've got some chronic self-inflicted ignorant inflammation in your body, like chronic alcohol abuse, chronic tobacco abuse, chronic smoking crack abuse, that's going to put you at huge risk. And I've told patients for 20 years, James, if you smoke, you're literally, your oral pharynx, your bronchial tubes, your alveoli are like a freshly plowed field. And the virus is just sowing its seeds in that freshly plowed field because you've caused inflammation from stem to stern, from top to bottom of your respiratory tree, the virus is going to thank you for that.
Yeah, absolutely. Smoking alcohol is terrible for a virus.
Yeah. It's good for the virus, terrible for you.
Good for the virus, good for a response to the virus.
Exactly right. Oh, let's see what else we got here. Have you seen any questions run by on Instagram? Simon says he smokes weed and eats armadillos. Is that in any way better? Come on, Simon.
No comment.
Simon, what are you doing, man? Come on. Let's see. Sudden drastic. Yeah. Oh, okay. There's a question about febrile seizures, and that's a very valid question. I don't know how much you've researched this, but febrile seizures, every doctor, including me, was taught if the fever either goes up too high or goes up too quickly. Some docs believe it's the velocity of increase. Some believe it's just whatever the fever gets to. That increases the risk of a febrile seizure. And when you actually look at the research, Doc, that's one of those things that is absolute bullshit medical myth. There is no research that shows that. That's a hypothesis at best, not even a theory. But there's actually been control studies done where they would give half the kids an antipyretic to control their fever, and the other half they didn't. There was absolutely no increased risk of febrile seizures in the kids whose fever was not treated. And I'm working on a YouTube video about that right now too, but I'm going to post the link to those two studies in the notes of that YouTube video. But if you had told me that as an MD back in 2003, I would have said, dude, you're nuts. Every professor I had in medical school, we talked about febrile seizures and how you had to keep the fever under control, or you, especially in small children, or they ran the risk of a febrile seizure. But the problem is none of the research supports that whatsoever, period. There's some protein or something that's coming from the viral infection that increases the risk of febrile seizures. No doubt about that. It is the infection that's doing it, but it ain't the fever. It's not the fever. And I guarantee you, if the average patient went to their healthcare provider and asked them, Dr. Berry said, is that true? They'd be like, hell no. Everybody knows that febrile seizures are caused by a rapidly increasing fever or a very high fever, but it's just not true. So don't be afraid of the fever, moms and dads out there, grandmoms, especially grandmoms, because they really worry. The fever is your body fighting the virus. You do not have to fight the fever. If you fight the fever, you're actually fighting your body's defenses.
Yeah, I mean, with context, right? So like you had said, 104 Fahrenheit, there's some risk there with potential damage to neurons in the brain, but this increase from 101.5 to maybe 103.5, if you hamper that febrile response to RNA viruses, you are reducing your body's own ability to kill the virus. And so, and you start taking Advil and Tylenol too quickly, with kids, you have to monitor their temperature, like every 30 minutes if they're getting up to the 103, temperatures, because they can really rapidly increase their fevers. However, there's a lot of questions I've been getting. Should I take Advil? Should I take Tylenol?
Yeah.
My doctor prescribed corticosteroids because of this inflammatory. Probably one of the worst things you can do if you have a viral infection, and I can share this study that corticosteroids reduce the body's activation of interferon regulatory factor 3. And remember, I said that's literally the linchpin. That is the key to how we produce type 1 interferons.
Exactly.
So corticosteroids are a terrible idea unless you need them for some other type of condition in RNA viral infections. Tylenol, in my opinion, is probably maybe even worse than Advil for two reasons. One, it's suppressing the fever, and The Guardian actually recommended people switch from Advil to Tylenol, which I'm not really sure there's any good data on that. So one is that it's reducing the fever. Two, it's basically reduces your body's glutathione. That's how we get liver toxicity from overdosing Tylenol. The last thing you want to do is rapidly deplete your body's glutathione stores in the liver, because glutathione, again, as we had said, is that body's antioxidant that's going to help with that lung inflammation.
Yeah, that's one of the best antioxidants your body makes. And so you definitely don't want to do anything that hampers that. Ann asked, what is a dangerous tip for a senior citizen? And my answer to that, Ann, would be there's not one. Your body, actually, as you get older into your 50s, 60s, 70s, 80s, and beyond, you very often don't mount as high of a fever as you would mount at a younger age. theoretically, that's part of the reason that infections are harder on seniors, is because you just can't mount the degree of an immune response as you could when you're in your 20s and 30s. It's an excellent question. What would you add to that, Doc?
I would say that's a super important point that you just brought up. And the clinical study that tested boosting glutathione showed exactly that. So in that N-acetylcysteine study, and I think it was about 300 elderly patients, 6-month randomized controlled trial, I believe it was in 20 centers in Italy. They gave N-acetylcysteine 600 milligrams twice a day for 6 months just before the cold influenza season. And they actually tested the elders' basically antibody response. And it was so much better after they had N-acetylcysteine because, again, that boosts glutathione. And elderly are really at a risk for low glutathione levels in the body.
Absolutely. And basically becoming a old enough senior, you are, by all intents and purposes, immune compromised, right? And that's part of getting older. And Marcella says, what about people with autoimmune disorders? And so that definitely, you're getting into a very complicated situation there, because very often people with autoimmune disorders are taking some of the biologics. They're taking methotrexate, they're taking prednisone, which is beating down their immune response. And so my number one recommendation for anybody with an autoimmune condition or some condition that suppresses your immune system, my number one recommendation is go into your house and close the door and do not come out and do not be exposed to anybody who might potentially give you this, because you're hugely compromised in multiple different ways. And so anything to add to that, Doc?
No, I think you nailed it with that one.
Yeah, you just got it. And so everything we talked about, the food, what to eat, what to avoid, all that stuff, you've got to practice religiously, and you've got to do it hunkered down in your house with very limited visitors, and just, you cannot go into crowded places. Buses, planes, trains are a potential death sentence for you if you're immune compromised. And I'm sorry to be so blunt, but I mean, this is not a movie. This is real life.
Exactly.
Let's see. You see any good questions over on your end, Doc?
I've been looking at your pretty face, so I have not.
Okay. All right. Let's see. Let me find another. You guys, if you've asked a question and we haven't got to it, then please type it again in the comments, and I'm going to try to catch a few good ones. Oh, somebody do you have a place on your website where you list all of the supplements you take on a daily basis? Somebody was very interested to know.
I don't currently, but I can add that to drjamesdinic.com. Absolutely.
Okay, guys, check his website in a few hours. He's going to list his complete supplement regimen, and that would be interesting. I'm going to check that out myself. Let's see.
Yeah, what I'll try to do is if they go to the website and they add their email list, I can send everyone an email. Yeah.
Renee said people keep commenting that elderberry is bad. Have you seen any negative research or anything that is in any way that it might be bad?
No, in fact, I mean, elderberry, in my opinion, has the most clinical evidence. It's the only supplement that actually has a meta-analysis of 4 randomized controlled trials in humans.
Yeah, it actually has more research backing it than vitamin C and zinc, right?
Right.
Yeah. So, and I'm a carnivore, guys, and I'm telling you, ain't nothing wrong with some elderberries. I think that herbs and medicines come from plants. That's what we get from plants. And absolutely do not be afraid of. Now, if you're adding, a cup of sugar to your elderberry syrup, then yeah, don't do that. That's stupid and bad. This is not about taste. This is about getting the vital, and I would consider these phytonutrients or phytosupplements at that point you're getting from the elderberry extract. And I believe definitely the research points to the fact that there's probably something there.
Sunlight seems important too for antiviral effects.
100%. Yes, I'm glad you brought that up. We know that we use UV radiation to make vitamin D, but I personally believe that we use sunlight for multiple other things that just haven't been investigated, because as you know, starting, in the late 60s, early 70s, it became anathema to say that the sun was good for anything, right? And so you can just imagine if I worked in your department and I went to your chairman head and said, hey, I want to do a research study and expose people to sunlight. I think that there's going to be some other immune benefits. Your chairman would be like, Who let this guy in? What are you talking about? No, we're not going to expose people to sunlight. What are you talking? Sunlight causes cancer. And so I think that research was squelched back when it became favorable to say that sunlight causes skin cancer. But what do you think about that, Doc?
I'll have to post the study. So back in the 1918 avian flu pandemic, right? So, Spanish flu, they actually used sunlight therapy and they showed pretty good results with it, which is kind of interesting. So I'll post that study too.
100%. And also it was well known back in the days when tuberculosis was everywhere. You moved west and you spent lots of time out in the sun and fresh air. And both of those, the influenza, the 1918 influenza and the tuberculosis, it may just be from the vitamin D, maybe potentially. But I suspect there's other things the sun does for us. We've been playing out in the sun for a long time. So
yeah, it definitely seems to be above and beyond just the vitamin D.
Absolutely. Ivy says, what about fermented foods? Everybody asking questions on YouTube is wearing their bikini today. I'm not sure why. So fermented foods, any pros or cons?
Yeah, I think probiotics, the correct ones, probiotic spores. I mean, I take both and they have dramatically helped my mucus and chronic allergies. I will say that. And we are all sort of dealing with some type of gut dysbiosis nowadays because we have heavy metals in our foods. We have toxins that we've never dealt with. 94% of us breathe polluted air. And so a lot of us are suffering with gut dysbiosis and inflammation. And I think, these certain evidence-based probiotics and probiotic spores and fermented foods that can help bring probiotics if you combine them with prebiotic foods is a potential strategy to boost your immune system because 70 to 80% of our immune system lies within the gut. And you were mentioning autoimmune disease, right? And we think we've kind of figured out how most autoimmune diseases are occurring. There is a depletion of the mucus layer, allowing exposure of toxins and food directly to the cells lining our gut. That damages those cells, the tight junctions open up, and now you can have food particles, anything can start, right? Like that's tiny enough to get through those tight junctions that are now damaged. And now you're presenting foods and foreign substances to 80% of your immune system. So it just freaks out, right? Yeah. Especially bacterial LPS, if it hits that immune system underneath your enterocytes, you can get an autoimmune reaction in different parts of the body. And so just because someone has Hashimoto's thyroiditis and someone has MS doesn't mean it's not like the same damage to the gut that's causing that.
100%. And anytime you're doing something like that confuses your immune system to the point where it actually starts attacking your cells instead of foreign antigens, then that's evidence that your immune system is very, very confused, and then obviously is not going to be able to mount a reasonable response to a viral aggressor. John L. says, will a flu test be positive if I have this virus?
Unless you have influenza.
Yeah, if you have influenza A or B, John, then it'll be positive. But no other viruses are going to show up positive on a flu virus test. The virus that the news is talking about now is not an influenza virus.
Sorry, I just
it's okay.
Instagram Live just canceled automatically, so I'll just
okay.
We'll just go to Facebook.
So we've been going almost an hour. Let me get one or two more big questions, Doc, and then I'll let you have closing comments. Let's see. Come on, guys. Questions. I've got some bots or spammers I'm going to have to block. I don't know when that started, but there you go. What about colloidal silver, Doc?
So topically, right, colloidal silver seems to have some really good antibacterial, antiviral topical effects. Whether mixing it in a solution and drinking it, I haven't seen those clinical studies, but I know a lot of people kind of swear by it.
Yeah, a lot of people swear by it. If you guys are going to use colloidal silver, please get a reputably manufactured brand. Blue Man syndrome is a real thing. I had a patient who had it permanently from taking a cheap formulation of colloidal silver. If you've never seen a picture of that, just after this live, go Google Blue Man syndrome from silver ingestion and you'll be blown away. It's a real thing. But you want to get a reputable brand, and I 100% agree. I think for skin abrasions and stuff, it works wonderfully well. Taking internally, I also have not seen any compelling research that makes me think that that would be mandatory or perhaps even desirable. Let's see. One more. Benefits. Any benefits of apple cider vinegar? This is a question that I get on every live about every single thing.
I am unaware of any antiviral effects of apple cider vinegar.
Yeah, I don't know of any antiviral effects it would have. I also don't know of any immune boosting effects that it would have. Not opposed to it, but I haven't seen any research that would make me think that it would help you in this situation.
There was one thing I wanted to discuss. Recently had discovered the other pathway that seems to primarily be driving inflammation in the lungs, and that's nuclear factor kappa beta.
Yes.
And so turmeric has really good evidence for inhibiting nuclear factor kappa beta. And so that's one potential supplement that I'm researching right now. The other one would be long chain omega-3s, right? And the sardines, wild salmon that helps to inhibit nuclear factor kappa beta.
Yeah. And I've got a link in the show notes for cod liver oil. It's my new favorite, man.
Just started taking that actually.
Me too. Yeah.
To help boost vitamin A, which we could kind of segue into vitamin A and vitamin D, which we didn't.
Vitamin A, vitamin D, and then DHA and EPA and tons of other vitamins and minerals in there. I don't mind the taste at all. You hear the horror stories, but I keep mine in the refrigerator door and I just take the top off and just take a big gulp once a day. Let's talk about vitamin A for a second.
Yeah, I mean, vitamin A is like, for when it comes to vitamins, it's one of the most important for boosting immunity and allowing your own immune cells to kill viruses. So many people are deficient in vitamin A, and I think it's very important. Yeah,
I think vitamin A and vitamin D are what we used to think vitamin C was. Remember back in the 90s, we thought a mega dose of vitamin C would kill everything. But I don't think that's probably the case. It helps in some cases, but vitamin A and vitamin D, I don't know of any of the other vitamins that truly strengthen the immune system to the point that they do. And as people who watch my channel often know, there's no vitamin A in carrots or kale. You have to eat animal fat to get vitamin A. It's a fat-soluble vitamin. And cod liver oil, sardines, anchovies, herring, mackerel, those are great places to get vitamin A.
Yep.
Yeah. Okay, Doc, you want to wrap this up and tell us any closing thoughts you have, and then once again, where people can find you?
I think maybe we wrap up where we left off, like you said, and the most important thing too, long-term, going beyond this global virus, is just being healthy and not developing these comorbidities, because the people who are suffering the most have the most comorbidities. So diet, right? Exercise, intermittent fasting, avoiding seed oil, sugar, refined carbs, super important. Making sure your diet is hitting optimal amounts of all vitamins and minerals.
Absolutely.
Very important.
And also to remind everybody who already has a chronic metabolic disease like type 2 diabetes, like fatty liver, like hypertension, you can improve those conditions. You can lessen those conditions. In some cases, it even appears you can reverse those chronic medical problems with the proper diet, with enough eating the proper human diet, with enough fasting and enough good sleep, enough sunlight, enough hot and cold hormesis, enough stress control. That's another big one we didn't even have time to cover. But you are not doomed. If you have type 2 diabetes, fatty liver, and hypertension, and you're like, well, I'm screwed. No, you're not. You can literally, as soon as this live is over, go and clean out your pantry and clean out your fridge and only eat foods that we would have had access to 100,000 years ago. Do not eat any processed carbohydrates. Do not eat or drink any sugar, either added or natural sugar. Do not eat any industrial vegetable seed oils that are manufactured in a factory. Stop all three of those right now. Get lots of sleep. Get out in the sun. Don't be afraid of the sun. Get some exercise, and then do some fasting. I promise you, your numbers are going to get better and better, and your odds of fighting off this infection or any infection are going to go up.
Exactly. I think sometimes people need that compelling reason, like, well, why do I really need to be so healthy? And one of the main reasons, why can't I just take vitamins and minerals, right?
Now's the time. This is the moment And for the last 2 years, and the last how many years have you, Doc, been harping on you've got to improve your health, you've got to improve your immune system response. And everybody's like, I mean, why? I want to eat what I want to eat. Why are you bothering me? Why are you yelling at me? I just want to eat my Wheaties. This is why. When this kind of thing happens, some of us, if we're metabolically sick enough, we just ain't going to make it.
Exactly. And I think a lot of people, if they could understand how these health conditions affect their own vitamin and mineral status, you can take all the supplements you want. If you are hyperinsulinemic, you will start spilling magnesium in the urine. So you're taking your magnesium supplement, you're thinking you're doing everything right. Not only are you losing more, you can't even get it into your cells because they're insulin resistant. Insulin resistance prevents us from utilizing many minerals, including magnesium, including potassium.
Yep. And vitamins can be, animals and plants can make vitamins. We can make some vitamins. You can't make a mineral. And so if you are getting it in your diet and then you're so hyperinsulinemic that you just pee it out, that's bad. Your body cannot make a mineral. You've got to ingest it, but you've also got to absorb it and actually use it. And you can't do that when you're metabolically sick.
Like we said, the worst thing for your vitamin C status is inflammation. If you can reduce your body's inflammation, you will no longer oxidize vitamin C as much.
Right, exactly. And you won't glycate every cell in your body, which a guy I watched very closely, Dr. David Sinclair, he said that there's actually some research out there that shows that the more glycated your cells are, and that's what the test, hemoglobin A1C, that's what it measures, is the degree of glycation, that the more glycated your cells are, the more likely you are for this virus to be able to attach on at the receptor sites. So this is the moment, guys. This is the time. It's time to put down not only the Twinkie, but also to put down the whole wheat bread, to put down the spaghetti squash and the sweet potato. I'm sorry, I know you love them, but I mean, it's time to lower your carbohydrate intake if we are, as a species, as a society, and you as an individual, if you're going to either not catch this or more than likely catch it and successfully fight it off.
Exactly. Yep.
Yeah. Doc, thanks so much for joining me. This has been amazing. The feedback is off the charts. People love this. Tell us one more time, a book and a website and anything else you want us to know about you.
Yeah. So I wrote 3 books, The Salt Fix, Super Fuel, and The Longevity Solution. My website is Dr. James DiNic, DINIC.com. My Instagram is at Dr. James DiNic. And I'm certainly continuing. I have a lot of papers that are either in submission or might be in submission soon on this virus and on just nutrition in general. So I will try to update everyone. If they go to drjamesdinic.com, throw in their email address, I'll try to update you and let you guys know what supplements I'm taking too.
Yeah. And Dr. DiNic, like myself, is also a formidable Twitter warrior. And he and I get in slap fights with people on Twitter all the time, and it's pretty entertaining, to say the least. Thanks so much, Doc, for taking time out of your Sunday to join us. Guys, I'm going to make this video available on YouTube, Facebook, and anywhere else I can get it to post. Please, if you know somebody who has prediabetes, diabetes, hypertension, fatty liver, any kind of metabolic syndrome, if they're round in the middle, if they're obese or overweight, you got to share this video with them, because everything I just said increases their risk of having a complication from this virus. Okay. If you haven't already subscribed to my YouTube channel, please do so. Like and follow my Facebook page, because we're trying to put out information like this all the time. And the only way you're going to get a notification is if you're signed up for it. Okay. Thanks so much, Dr. James Dinicolantonio. I will see you next time, my friend.
You got it.
All right, man.